Welcome to our latest Thursday installment of our Ostomy webinar series. We have a brand new topic today that we're super excited about. It's something that I'm personally very excited about as well, because there's so much to learn. We're going to talk about insurance, typically a black hole subject for a lot of people because it can be so complex, but it's so important to kind of understand how insurance works and kind of get a little look into that black hole, which I hope we'll be doing today with Siobhan, especially when it comes to your medical supplies. It's really important for ostomates to know, and everyone to know, what's covered, what's not covered, what does it mean if something is covered? How can you make sure that you understand what your benefits are and that you're kind of taking full advantage of them? So we'll cover all of that and more. Show's done a lot of research for this. Obviously, she speaks from experience. And so super excited to understand costs, understand insurance, and then of course talk about, the best way to get your supplies, the best way, the easiest way, hopefully the cheapest way to get your supplies. And as usual, we do have time for Q&A at the end, but please feel free to reach out with questions anytime. You can use the chat function at the bottom of your screen. You can use the Q&A function. So please feel free to interrupt us anytime, add your own tips for your fellow ostomates, ask us questions, ask us to clarify. We'd love this to be a conversation. But just for those who are new here, we'll start with a little bit about who we are. So we're Better Health. We're a medical provider, and we really take a holistic view of your healthcare journey. And we speak from experience. We have a lot of ostomates on board. We have a lot of people with chronic conditions on our team, including Sho. And so we understand that, your healthcare journey is obviously so important, but it's so much more than just, getting your supplies. So we are a supplier. We are able to help you kind of make the best product decisions for you and then get you those supplies. But it also is about so much more than that. We have a lot of educational resources, such as this webinar series. We tackle a different ostomy topic every single Thursday. We also have our monthly fireside chat series where we bring in external experts. We have nurses and doctors and insurance experts and all of these great people. And the idea there is to give you guys access to those people, hear their stories, benefit from their experience, ask them questions. We also have a fantastic coaching program for our ostomates. Sho is one of our coaches. It's a one-on-one conversation. You get a phone call, you get 30 minutes to talk to an ostomate, complimentary as of now, to ask them any questions that you want, to share tips, to just get some support and meet other people who really understand what you're going through. So we do have that coaching service where we'll send you all of these links, so you'll have those resources at the ready when you need them. But enough about us. I will pass it over to Sho for the reason why we're all here, and we'll talk about ostomy and insurance. Over to you, Sho.
Thank you so much, Ariha. Always glad to be here on Thursday with you beautiful people. Ariha calls me Sho. My name's Siobhan. It doesn't matter what you call me. I'm pretty, can figure out what you're trying to get my attention. I've had an ostomy myself. I have an ileostomy specifically, and I've had it for 6 years. Prior to that, I had a diagnosis of ulcerative colitis for 12 years. And then prior to that, I had some pretty horrible bowel trouble all through my life growing up. So it's been quite a journey. I was really glad to get my ostomy surgery. I always say that it gave me my life back. It gave me an opportunity to get out and enjoy the things that I love. I always post these photos of some of my favorite things. My daughter there is, always willing to accompany me on adventures. And my guinea pigs are infinite source of entertainment, especially during the past year when we've been stuck at home. So, I'm so glad that I'm healthy enough to be engaged in my own life. And it's, there's been some bumps in the road, but it's been worth it getting better and getting healthy and having this ostomy surgery. So enough about me. Let's talk about you. If you're here today, you have questions about insurance and how it works, and does it cover this thing, and does it cover that thing, and why doesn't it cover that thing? So, I'm here to answer a lot of those questions and hopefully leave you with some clarity. But if you go away more confused than you were when we started, I've done a bad job and please let us know. This is actually the first time that we've done this webinar. And that being the case, we're maybe starting from the bottom and we can only improve. So please don't hold back your thoughts and your opinions at the end. And one little final thought, sorry, we're going to do a little bit of math today, but I kept it very simple so you can understand it, and even more so I can understand it. I'd like to keep it simple. All right. So my goal for you today when you walk away is to have a really strong baseline of how ostomy supplies work and how medical suppliers work and how insurance works and how it all works together. So there's not going to be a quiz at the end, but there are some key ideas that I want you to understand. It's that ostomy supplies are medically necessary. That's why they're covered by insurance. You might have some out-of-pocket costs depending on what kind of insurance you have. Honestly, you order your supplies from a reputable medical supply provider like Better Health, or another company that you've had a good experience with. And bonus, I'm going to explain today why there's no such thing as the cheapest supplies. There's just what we can do to maximize your coverage and the amount of supplies that you're eligible to receive. So, insurance 101. Here's the basics. What ostomy supplies are usually covered? This is a big question for a lot of our customers. And ostomy supplies are covered, there's quite a few that are covered by insurance. There's the barriers, the pouches, whether you use a one-piece system or a two-piece system. There's things that you can do. You can use your insurance to buy in terms of skin protection. Things like, if you're changing your pouch, you want an adhesive remover that helps you gently remove that pouch from the skin. Maybe you have some bumps or creases or folds or a hernia. So there are things that you can get that will help manage those, and things that you can fill in those bumps and creases or get some convexity. So all of those things on this list are covered by most insurances. They're for sure covered by Medicare. So when I talk about insurance, I'm usually talking about what Medicare covers. It's just a point of clarity. And the reason I'm talking about what Medicare covers is because many insurances base their own coverage on what Medicare allows you to purchase. They're like, oh, that company, Medicare over there, they came up with a pretty good system, so we're basically going to copy it. If you're lucky and you have fantastic insurance, sometimes you'll get full coverage and you don't even have to worry about getting a bill for your ostomy supplies. But for many of us, we're working on a budget and we're working with Medicare, and we'll probably have some out-of-pocket costs. So unfortunately, there are some things that Medicare and insurances don't cover. So that includes things like ostomy wraps. An ostomy wrap is usually like a fabric belt that you wear, and it has a pouch in it that will support the ostomy. It has a pocket in it that will support the pouch and its contents, and it's good for ostomy wraps are usually used for like concealing bags under clothes. Again, for that supporting the pouch and holding it close to the body. Bag covers are slightly different. Bag covers are, like they're fabric covers, and they're also good for, concealing the pouch under clothes. They can minimize rustling. They can absorb some excess moisture. And then ostomy underwear, which you can usually, there's several suppliers out there that provide ostomy underwear, which also has a pocket in it. And I actually buy ostomy underwear. I find it really great and very useful, but I am paying out of pocket. I just spent $125. It's not covered by insurance. So it's a bit of an ouch, but to me, it's personally worth it. And unfortunately, insurance doesn't cover it. Next, again, we're at 101, right? Baseline. How do I use my insurance to get supplies? So I know from my personal experience that when I came out of the hospital, I had no idea how to buy my supplies. I knew that I would well, I wasn't even sure I would ever, how to get them. I just assumed that I think they would show up at my house somehow. It's not the case. You have to take steps to get your ostomy supplies shipped to you. So in order to do that, you have to enroll with a medical supply provider like Better Health. And what the medical supply provider does is they verify that they are able to bill your insurance. So not all medical suppliers can bill all insurances, but we at Better Health can definitely bill Medicare. Um, they will contact your doctor for your prescription for your ostomy supplies. So the reason is that in order to bill insurance, you need a prescription. And then they'll verify what you need with you, and they will ship you your supplies. And hopefully, they verify, they get it right, and they will ship your supplies to you quick. I can guarantee that these are all things that we at Better Health do. So if you are looking for a medical supplier, we'd love to have you on board. That's the end of my sales pitch. So here's a big question that comes up: is why when you're buying your ostomy supplies and using your insurance to pay for them, why is it so hard? Why is it so complicated? Well, like I said, there's ostomy supplies kind of fall under this weird, unique category. So they're durable medical equipment. That means that they can be used over and over again. They are used for a medical reason because you have an ostomy. They're not really useful to someone who isn't sick or who isn't injured or who doesn't have an ostomy. They're used in your home, but also outside of your home in this case. And they must be prescribed by your doctor. So, like I said, you need a prescription, and like you would for like insulin or high blood pressure, but you can't get this prescription filled at a pharmacy. And that's why it's a little confusing. You usually go to a pharmacy to get your drugs. But on the other hand, ostomy supplies also sort of seem like they're they're like other wound care supplies that you could buy over the counter, medical tape or bandages or gloves, that sort of thing. But because they're regulated by the FDA, you can't buy ostomy supplies over the counter, right? So what do? Well, there's a third place. There's the medical supply company, which is how they all kind of triangulate and come in together, is one big connection. Okay, so that's enough about the insurance piece about it. Let's talk about the cost piece. So your out-of-pocket expenses you can expect, like I said, with Medicare to cover 80%. Why 80%? Who knows? Why not 100%? That would be fantastic. 80%, was somebody's lucky number. Maybe it was, but it was also a number that they figured out based on a ton of like actuarial tables, and information and data about how long people live and what their likelihood of using the supplies for, and or having to use the supplies and how long they use the supplies and all that other stuff. So 80%. And then out of pocket, you're probably going to be paying 20%. So that means that well, here comes our math. So if you have say your ostomy supplies cost $100. Okay, that's great. You place your order with your company. You're using Medicare to pay for your ostomy supplies, which means you'll pay $80. And then, they will pay $80 and then you will pay $20. That's our example one of expenses. This is as hard as the math gets, people. So, and so I hope it's accessible. What are your out-of-pocket experiences in a different scenario? If you have Medicare, but you also have, say, Plan C, which is supplemental insurance or a secondary insurance. So your ostomy supplies cost $100, but then, your Medicare still pays 80%, but then your secondary insurance pays 10%. So in this scenario, it's $10. So 80 plus 10, $90 is covered. And then that leaves you with $10. So to pay out of pocket. So in this case, if especially if you're having to buy ostomy supplies every month, which you will for the rest of your life if you don't have a takedown, and you know that they're pretty costly, this might be a scenario where it might be cheaper to purchase like secondary insurance to cover that out-of-pocket cost, instead of trying to just pay it out-of-pocket cost. All right. Understanding costs. How can I buy the cheapest supplies? All right, my little rubber ducks. This is the bad news. In a perfect world, we could buy ostomy supplies according to a price point, right? You could buy good ostomy supplies. You could buy better ostomy supplies. You could buy best ostomy supplies, right? If you're going camping for the weekend and you need a cooler, you can go to your local like big box store and you might find one that's like it's just plain old styrofoam. And then you might find one that's like an igloo. That's a pretty decent mid-size price, mid-range price point. Or you might like decide to go all in and get a Yeti cooler for $250. So yeah, that would be nice if that's how it worked. But in fact, it does not work on that. It's all based on a special thing called a HCPCS code. So I'm going to go into a little bit of detail here to explain why there's no such thing as, like these different price points. And a lot of people do ask us, they're like, give me the cheapest supplies. And we'd be like, we'd be happy to, but that's not how insurance talks about pricing. Insurance is just interested in codes. So for instance, here's an analogy. Insurance doesn't know that you're ordering the Sensera Mio Click 2-piece drainable ostomy bag with opaque fabric, rustle-free fabric, and it's got a hook and loop closure for easy closure. That's all marketing talk. And actually, I don't mean to pick on this particular pouch because it's actually a great product and I've used it and had great success for it. That's not what the insurance sees. The insurance actually sees this. It sees that you want to order an ostomy bag that's drainable, that has that doesn't have a barrier attached, that is plastic, and it has a filter, and it's opaque. So these are all characteristics of the pouch, but it doesn't see if I were to sub in a different pouch from a different company with the same characteristics, with the same features, it would, you couldn't tell. It would just be a generic, a substitute. So, here's another way of looking at it. Say you need to buy a t-shirt. So it's a standard basic t-shirt. It's got 2 armholes and a neck hole. It's made from cotton. It doesn't matter whether it's from Hanes or Nike or Under Armour. In our example, all of these t-shirts, regardless of where they're from, have the same HCPCS code. That's HCPC. I mean, we pronounce it HCPCS in our insurance world. So for the purposes of giving you an example, we'll say this HCPCS code is A0001. However, you are planning a trip. Your trip is going to take you to Michigan in February to do some ice fishing, which sounds amazing. I've never done it, but I think I'd like to try it. You're going to want a t-shirt that has long sleeves, and maybe you're going to want wool because it's warm. So now this is a different HCPCS code because it has a shirt that has different characteristics. It has long sleeves and it's wool. All right, cool. So now let's say you're planning somewhere vacation somewhere tropical. And I hope everybody is able to plan some fun trips now that we have broader vaccination and things are easing up and we can get out of the house and visit places. So you're going somewhere tropical where you certainly don't want to wear a long sleeve wool t-shirt, and you probably even don't want to wear just a regular t-shirt. You really want that sunshine on you. So you need to order a sleeveless shirt, and it's made from sport fabric like nylon or polyester or some other man-made product. So this t-shirt is now sleeveless and polyester, let's say, and it gets a different HCPCS code because it is a different kind of shirt. So it's A003. So the point that I'm trying to make here is that you buy a shirt based on what you need, not necessarily what it costs. So it's the same with ostomy supplies. You select an ostomy pouch or supplies on what you need, and the cost doesn't really figure into it. You just know that you need, for instance, an ostomy pouch that is drainable because you have a high output ileostomy, or you know that you need to buy a urostomy pouch because you have a urostomy and you need to have a pouch that can safely handle urine and keep it away from the stoma. So, you know, not to make too fine a point on it, you need to buy your supplies according to what you need, and not, you know, fanciness or brand name, that sort of thing. All right, ordering supplies. So on ordering supplies, how many supplies can I order? We get this question a lot too. And the answer is there's usually a maximum that you can order that your insurance sets. So for instance, with ostomy bags, and I'll give you a little chart here in a moment, but with ostomy bags, you know, usually get enough bags to last you a month. Or they'll let you have, they'll let you order, like, say you need ostomy barrier rings to go underneath your barrier when you put it on your skin. You know, say you get 10 of those a month. Or if you're using a spray for your ostomy to is either an adhesive remover or is a skin protectant, either of those, you might get like 1 can a month or 1 tube a month. So it's, you know, it's usually what you can use up in a month. Typically you can order a 30-day or 90-day supply. And I recently talked to somebody who said that her company was requiring that Medicare was requiring that she order a 90-day supply. And that made me really unhappy because that's not the case. You do not have to order a 90-day supply. And in fact, we say maybe don't order a 90-day supply for a couple of reasons. One, 90 days of ostomy supplies is a lot of supplies. Next, I already realized what I can do for my next presentation of the same topic is to add in what you might expect to get and the number of boxes in your big brown box of supplies that comes to your front door, because I think I calculated it and it was something like, you know, 30 or so boxes of ostomy supplies if I was going to get, you know, shoebox size, tissue box size boxes if I were going to get 90 days of supplies. So, you know, this poor lady was thinking that she had to order all of that. Well, one, she may not go through all of that. Two, it's kind of a shady practice on the medical supply company because what they're trying to do is trying to get a larger, you know, get more money from the insurance companies, even though it's not necessarily in their members' best interest. And we certainly don't do that at Better Health. So in fact, we say only order what you can store safely, you know, what you can keep out of the sunlight, what you can keep in a cool area, what you actually think you'll need. I've had some occasions where I've kind of got backstocked on ostomy supplies because I didn't have a good sense of how much I should order, and then the supplies expired and I couldn't use them. So, you know, 30 days is absolutely fine. You may experience some other things like your supplies aren't working for you, or you experience an allergic reaction, or some other thing comes up and you only have 30 days of supplies to get rid of instead of like 90 days. So it's really important to order the appropriate amount of supplies that you need. So here at Better Health, you can order 30 or 90, whatever is allowable under your individual plan. And then to go into a little bit more detail about, you know, how many you can expect to get. Well, with Medicare, and this is just an example, if you're ordering a 2-piece drainable bag, you would expect to get like 20 of those per month. So I personally use a drainable bag. I don't go through anywhere near 20 bags a month. I usually wear my bags for 4 or 5 days. And so if I'm changing it, let's say 4 days, I might, use up 6 bags a month in total, and not 20. If you're using like a 2-piece clothes bag, well, those are meant to be thrown away. So you might use up to 60 of those a month. They're meant to be used once and thrown away. So, it's the allowables are going to be different per product. What if I need more supplies? This is a really common question as well. And it's, it's normal. It's really common to use a lot of supplies in the beginning. I certainly went through my own fair share of supplies as I was learning to like cut holes the right size, or I had to go to a larger barrier because my stoma was getting pinched, things like that. So, there's definitely there's an allowance built in for a learning curve. Sometimes stomas change or grow or recede or retract and create a need for different barriers. So that's a very normal problem to have. And then sometimes you might develop a skin issue, even though you're doing everything right to take care of your skin. And in that case, you might go through barriers more often because it's hard for a barrier to adhere properly to skin that's irritated or red or, crusting or what have you. Okay, so but I haven't really answered the question of what if I need more supplies? I've just told you that it's okay to need more supplies. If you're going through these supplies too quickly and things don't apply, and these things that I've talked about don't apply to you, it's a good opportunity to reach out and ask for help. You can ask for help by contacting your medical supply company and saying, hey, I'm using up supplies really, really fast. Is there a way for me to get more supplies? And the medical supply company is probably going to tell you, maybe. They're going to say, yes, you can certainly pay out of pocket for the entire cost of the supplies, but they're also going to offer you the opportunity to fill out a special little Medicare form requesting more supplies that will have to get signed off by your doctor. And you also have to agree on this form that if either your doctor rejects these extra supplies or the insurance company rejects these extra supplies, that you're still going to pay for them. And another case, if you need extra supplies and you reach out for help, you might be having a problem that needs to be addressed. So sometimes we find out that people are going through supplies too quickly because they don't know how to use them properly, and that's okay. Once I fairly recently, actually, like this happened twice in 2 weeks, is that we find out that somebody's using a drainable bag for their ostomy, but they're treating it like a closed bag. So if we go back to that little chart right here, you only get 20 drainable bags per month, but you get closed 60 up to 60 closed bags. So they were letting their drainable bag fill up and then throwing it away and not using it for several days in a row. And then of course they're going to run out of bags because they only have 20 of them. So what they should have been using if they want to throw away their bag and instead of draining it, is to use a closed non-drainable bag, of which you get 60. So that's what you should know, is that you need to find in your medical company, your medical supply company should be able to help you with identifying, oh, this product is not quite working for you and you're going through it too fast because of these issues. So at Pure Better Health, one of the things that we're able to do is offer you ostomy coaching, like Ariha mentioned earlier. And we often identify these exact problems. And we've had people come back to us and say, thank you so much for letting me know how to get around this problem using supplies. And actually, here's a tip for you. So I hope you write this down. Sometimes with supplies, you can order 2 different bags. So maybe, for instance, going back to that t-shirt analogy, you need both a short sleeve t-shirt and a long sleeve t-shirt. So maybe at night, you want to put on a closed bag for whatever reason, for your personal preference. But during the day, you want to wear a drainable bag for, again, personal preference. So you can order, both types of bags, and because they're different, they're different bags. They're usually that set of two different is approved by insurance. I mean, you're still going to have to pay out of pocket, but it also gets you up. It ups the number of bags you have available to use per month. Okay, and then finally, people ask us, should I buy supplies for cash at online sites? No, it's not recommended. You can. Many people do, but hopefully you have insurance and you're able to use your insurance to pay for some of the cost of these bags. The reason we don't recommend buying bags at online retailers who are not medical supply companies is because there's no quality control. It is often the case that one of my enrollment advisors or member care folks, contacts me and says, Siobhan, have you heard of this bag? I can't find it. And so I go and do some research, and then I learned that it's a knockoff bag. It's being made at some factory with no quality control, and it's being sold very cheaply. And then somebody says, oh yeah, I've been using this bag and it works pretty great. And then about 4 or 5 minutes into the conversation, they're like, yeah, and it doesn't stay on and it falls apart and all this other stuff. So, and then I learned, oh, they're not using a bag made to the quality standards of the major manufacturers. Sometimes people sell their supplies if they have too many supplies. So you may not know, they may look good, but these supplies may actually be expired, which is a good reason not to use them, because certainly you don't want a supply that expired and the adhesion is no longer good inside your barrier and it falls off your stomach at a really inopportune time. Sometimes these supplies are stored in poor condition. So it's basically the same problem as I mentioned before. The expired supplies are, the poor storage conditions may cause the materials in the bag, the barrier, in the paste or the barrier rings or the extender ships to break down. Maybe they were stored too hot, too cold, you don't know. But with Better Health and other medical suppliers that are reputable, that those supplies are stored in temperature controlled conditions, and it's not until they don't leave the warehouses until you're ordered. So, at most they're out in, the USPS truck for 5 or 6 days. I'm sorry, 2 or 3 days, not 5 or 6, that would be bad. And then, finally, I got ahead of myself. I mentioned those knockoffs. So, again, I want to say it's really important that you have some key takeaways today, and those include, like I said, making sure you get really good supplies from a really reputable place. You don't have to stick with the supplier that you maybe got signed up with in the hospital, or that the first one that you encountered when you looked on the web. Your medical supplier should be able to talk to a real human. You should be able to get your questions answered in a timely manner. You should get callbacks. You should get the information that you need. They should be able to tell you about products, and there's so many things that your medical supply company should be able to do for you. The paperwork, contacting your doctor, figuring out insurance questions, all that other stuff. So, don't feel like you're stuck with bad customer service. There are amazing alternatives out there, including us. You should be able to order the supplies that you need. So don't skimp on supplies because it's critical to your healthcare. Bad supplies, cheap supplies, you want to stay away from that idea. You want to make sure that your stoma is protected, that your skin is protected, because otherwise you could be looking at complications that might mean more doctor's visits or another hospital admission. So, it's really key that you put a lot of value and in time into ensuring that your supplies, are taking care of you. And then, finally, your medical supply, your medical supplier should really should be able to help, with your insurance questions. Again, I'm repeating my first point a little bit, but it's just so critical that you know what your options are, and that you are able to find a good something that works for you. All right, so I hope I've raised some questions in your mind. I'm looking forward to seeing what you have to ask. And before we get into the Q&A portion of our session, I want to make sure put in a pitch for our coaching sessions. We had some spots open up this coming week that we don't usually have open up because of some issues with an ad on Facebook. So we have more spots open than we would normally. And if you have issues with your ostomy pouch system, or if you have questions about, well, I'm not going to say insurance, because our ostomy coaches aren't really insurance experts. They're more product experts and stoma experts. But we will certainly find the right person to ask your questions about if you're experiencing, a high or over usage on your supplies, or you're having too many leaks, or things of that nature. So it's a one free session. It's 30 minutes. You talk with me, you talk with one of our amazing coaches who joined us today in the chat. Her name's Lynette, or Emily. And we'll at least get you on the road to figuring out what's going on. All right, so now we can open the floor. We're going to allow you guys to unmute yourselves and ask a question. I think I see somebody's posting. Oh, yes. And my colleague Ariha has put a link to the coaching sign up in our chat. So you can use that to, sign up for a session if you haven't already done so in the past. I see, Jeanette, did you unmute yourself with a question? Or John, I see. Oh, somebody's buzzing in. John, did you have a question?
Well, I'm having an issue with my insurance and my supply company. They have been fighting for about a month, and my delivery of supplies has been delayed. I had to go out to another company and buy some supplies to tide me over, hopefully till this gets straightened out. My supply company tells me that they are limited by contract as to how much product I can receive, and that's the contract with the insurance company. My insurance company says there are no limits. If you need them, we will pay for as many as you need. You just need to get an updated prescription.
Mm.
So I have the updated prescription, but the supply place says we can't send it because of our contract with your insurance company. I don't know where to go. My insurance company has spoken with my doctor about it. The supply company was supposed to speak to my doctor, but they never did.
Do you have, John, what type of insurance do you have? Medicare or second or private?
I have a Medicare with a secondary policy.
Wow, so you should be covered. It just sounds like there's a breakdown in communication. And I know that sounds really, really frustrating. So, your options are, and I'm so sorry your supplies have been delayed. It's not okay for them to be delayed. They are essential to everyday life.
Yes.
So you know, I would say your options are, one, you could, you know, reach out to a different supply company. And, you know, we'd always be happy to have you on board with us. And, you know, we'll definitely make sure that communication ball isn't dropped. Um, and, you know, have you, it sounds strange to me that, that the prescription piece of it is, you know, making is not is interfering with things. You know, I wonder if, did you say that you have that you have an updated prescription with your supplies?
Yes, the insurance company decided that the best way to solve this issue was to get a new prescription from the doctor. And my doctor has sent a new prescription to the supply company and to the insurance company. The plus supply company doesn't give a hoot about the new prescription because they say they are limited by their written contract with my insurance company only to supply this amount.
I see. Yeah,
Now,
I think,
and I have a copy of the codes from Medicare, and the bag that I use says that there's no limit from Medicare.
is it like a specialty bag, like oversized
Yes.
bag, or you're not sure? Okay, that's okay. Yeah, I would say, you know, it would be a squeaky wheel with your current company.
Oh. They're tired of hearing from me. I have called at least 10 times this month.
Oh, I'm so sorry to hear that. Yeah, I mean, I highly encourage you, if you want to put your email in the chat to the panelists, we can get you connected with somebody here who could help you, you know, who could help untangle things and get, you know, get what you need, you know, get the ball rolling on that.
I did call and I talked to your I don't know, some very nice lady who said she'd been there 5 years and she knew all about this stuff, and said that you would probably be subject to the same limits.
You called us?
Yes.
Oh, wow. I mean, we're a fairly new company, so I'm wondering if you did talk with somebody here, because we're less than
Yes.
2 years old.
Well,
So,
I didn't say that it was all with you.
oh, yeah. So I would say, you know, you should definitely research supply companies and find a different one, because it sounds like they're not serving you.
No, they're not. Oh,
No.
thank you very much.
You're welcome.
Mhm.
Yeah, one of our, Lynette, who's our ostomy coach, who's here today, mentioned in the chat that if if you if you need more supplies than you're getting per month, you can and you should appeal to your insurance company if they say you can't have more supplies than what you need. You know, sometimes it takes, as John was just illustrating for us, it takes a couple of tries and a push from your doctor. So, and it's really unfortunate that that's the case. One of the reasons I actually joined this company was to make sure that people didn't have the same experiences, you know, I've had with getting supplies. You know, we as ostomists are our own best advocates. And it's important that, you know, we advocate for each other as well. So, you know, that's why I'm working here. That's why I'm doing these presentations, is that this information isn't clear, especially to those of us who, especially in the beginning, are coming out of surgery, adjusting to life with a stoma, and may have missed the part where we need to fight with insurance companies and doctors and medical supply companies to get what we need. It shouldn't be that way. It should be very smooth. So, you know, that's why I am so glad you're here today to learn about this sort of problem and how to resolve it, but also to let you know that there are better options out there. So any other questions? All right. Okay. So I've hopefully left you with clarity and not completely befuddled today. After our chat, we will be sending you a booklet. I don't have a picture of it here today, but we usually send out a PDF booklet that's between 3 and 5 pages that's on the topic of what we discussed. And it contains the same information in more of a pamphlet form. And then, of course, if you're interested in the recording of today's webinar, or if you want to look at the slides, we can do that for you too. And then I believe Ariha, my colleague who introduced me, is going to put up a quick chat, a quick poll in the chat that is going to ask you how helpful you found it today. And just to clarify for you, there's not a good way to say this on the poll itself. It's a limitation of the software, but you can say 1 is least helpful and 10 is best.
It's on the poll actually.
it?
Thanks,
Okay.
Joe. Yeah, you should see it all. You should all see it on your screen right now. It's just 2 questions, so we'd really appreciate you filling that out.
Have you, Ariha, have you gotten your polls back?
Yes, so we've got 2 people who voted. Thank you to those people. If the rest of you could fill this out, that would be very, very helpful for us going forward. And just to echo Siobhan, we will send out an email after this with the link to the coaching once again, as well as the recording for this session. So you're welcome to refer to it and watch it again anytime. As I said at the beginning, we do these every Thursday. Next Thursday, I believe, oh, I've lost my calendar, but I believe that next Thursday we are doing, I'll look that up. Oh, next Thursday we're doing Urostomy 101. So we're going to talk about, urostomies and everything you kind of need to know about those. And we hope you'll join us. Thank you all so much for filling out this poll. Thank you for attending. We look forward to seeing you again soon. Thank you all.